Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter I. Today I'm going to talk about a group of conditions associated with the interspace. Those interspaces in the body refers to the cavities or the ventricles in the brain or the pleural cavity or pericardium. First of all, let me just bring up any emergency situation that associate with these cavities. Yes, trauma, for example, cause the pneumothorax, break up these two layers of pleural space, and then the air fill in the space, squeeze the lung up so cannot breathe. So that is the emergency. Could be very life-threatening. Has to visit your emergency room as soon as possible. Or the trauma caused the tamponade of the pericardium around the heart. The fluid or the blood fill in the cavity so the heart cannot dilate, cannot pump the blood out. So those are the life-threatening emergency. Has to see a physician as soon as possible. Or the inflammation, even though the inflammation usually for these spaces, either pericarditis or the pleuritis, caused by the slow progress, but still the pain and also the sudden getting worse with the fluid, impaired breathing or impaired the heart regular contraction or dilate. So that is also, even though it's not emergency, has to be seen in urgent situation, has to see a physician as soon as possible. So, and then after talk about this emergency situation, anything associated with those spaces or the cavities, can you manage at home? Probably not. You have to be managed by the physician. First of all, the space are subtle. The symptoms might be subtle or severe. Secondly, actually, because of those cavities are associated with around the important organs from the lung, or heart, or brain, so has to be has to be managed by a physician, or the intra-abdominal space. Inflammation of peritonitis, for example, has to be managed by a physician, even though it's not urgent, not emergency, but there's no way you can take care of it by yourself. It has to be treated under the guidance from the professionals. So having talked about these conditions, let me just briefly introduce some of those cavities and also the spaces. In the brain, for example, what are the functions of those cavities or the spaces? In the brain, there's some ventricles that are the subtle spaces circulating the cerebrospinal fluid, serving the nutrients to provide nutrients for the brain, and that's one way. The other way is those subtle space with fluid will buffering the mechanical force just in case the damage or the trauma. So that's the function. And also those subtle space can serve the lubrication. For example, the pleural space, the two layer of pleural membranes, one on the wall of the chest, the other one on the surface of the lung. You imagine two balloons, if you rub them against each other, you feel very hard. The frictions are kind of very tight and with a squeaking sound. But if you feel the fluid around the balloon, if you rub it again, then that's the will easier. So the same idea for this interspace containing the fluid, serving the lubrication for the lung expanding or breathing out or breathing in. The same idea for around the heart. There are two layers of pericardium, and fill in the space are the fluid to lubricate so the heart contract or dilate without any frictions. So these are the major important cavities and the spaces, and the diseases associated with these kind of cavities, like in addition to the trauma, chronic inflammation are the other causes. For example, systemic disease like lupus or rheumatoid arthritis, easily to get the inflammation for those pleuritis, for example, or pericarditis. The consequence of this kind of inflammation, those fluid will become dense, undergoing fibrosis, so will cause severe pain because those two serious membranes contain rich of nerve fibers. So if the inflammation is severe or has been going for a while, then really can cause this fibrosis. At the same time, if the fluid is too much caused by the inflammation, then impair the heart contraction or dilate, or the lung either expanding or breathing out. So those are the pathological condition or the diseases associated with these subtle spaces. So the symptoms, clinical presentations for those spaces are quite sensitive, like I said, because of the reach of nerve fibers. The end nerve endings are rich, distributed along those membranes, serous membranes for the protection. So the characteristic of the clinical presentation is the pain associated with the position, or associated with the breathing, or associated with the heartbeat. You can imagine, for example, the two layers of the pleurals. So if the inflammation is going on in between these two layers, when you breathe out, the space getting bigger and stretching the membrane, or serous membrane, or the pleural, causing the pain. So the same idea for the heart. So these are the characteristic of presentations of the inflammation, or the other causes by the infection, either bacteria. Majority of the bacterial infection causes this pleuritis or or the pericarditis. If that's the case, associated with high fever, could be very serious, very painful. So that associated with the breathing or positional, the chest pain. So that's the other signs, or you might pay attention to. Those are, of course, they have the risk factors for those infections, either with comorbidities or exposed to bacteria or any other systemic infections, septic disease. So these are the subtle space. And the other one is the other cavity, of course, intra-abdominal cavity also. Any inflammations, either bacteria or non-bacterial, infectious, non-infectious, can cause this peritonitis. It's quite sensitive to tell how severe the disease might be, either if it is the inflammation very serious, and for example, the appendicitis, we can tell whether it's whether the guarding or not guarding, whether the abdominal wall feel really stiff because the peritoneal membrane was irritated by the inflammation. So these are the very superficial, not deep into the medical medical professionals, but these are for the general population to give you some idea what kind of signs or symptoms, or what are the risk factors associated with this interspace, subtle space in the body. In terms of treatment, of course, if there's inflammation, then anti-inflammatory associated with the lupus or rheumatoid arthritis. If there's infection, then of course has to be diagnosed or identify the pathogens, and use antibiotics to target those bacteria, so to treat. So this is about the video of talking about the interspace and also the disease. I'm going to stop here, and I hope it helps you, or it trigger your interest. You can search more. Thank you for watching. I will see you next time.